Welcome to lecture for research methods. This time we'll be talking about how to evaluate a research study. And again, lots of overlap between what you need to know to evaluate a research study and what you need to know to design a research study. So you should be able to apply much of this information in terms of designing your study for your proposal as well. Okay, so what things need to be evaluated? The relevance or importance of the study. Does the study need to be done in the first place? Would the findings from a study contribute to or challenge existing theory about human behavior? Or might the findings have some practical implications or applications regarding how people live their lives? Construct validity. Did the researchers measure or manipulate what they say they did? Internal validity. How confident can we be about the truth of any cause and effect relationships between the variables examined? External validity. How confident can we be about generalizing the truth about relationships between or among variables in the study? How confident can we be about generalizing that truth beyond the circumstances or characteristics of the study? The statistical analyses that were done, were they the ones that were chosen, were they appropriate for the data collected? And how likely is it that the authors would have been able to detect meaningful relationships given the data they had and what they did? And last, you need to keep an eye out for any kind of ethical concerns with the study. Was the study conducted in a manner consistent with professional ethics? Okay. Starting off with relevance or importance. Did the authors identify a relevant theory or theories that would be tested by their study? And this type of information you're going to be looking for in the introduction section of a research article, right? So did they justify their predictions for the hypothesis based on theory, right? This is an important thing to think about because science moves forward most quickly and most assuredly when studies have a clear impact on theory, right? If there's no theoretical context for a finding, it's hard for our collective knowledge of behavior to move forward because people aren't sure where to hang it, right? Even if you have to come up with a new theory, fine, but give it some sort of context so we know how it fits with other findings and other things that have been found. If the researchers are identifying some real-world problem that this study is relevant to. So maybe, okay, there's not a clear or a strong theoretical tie-in. If not, then there definitely needs to be some sort of connection to a real-world problem. So how much of a problem is the thing that they are suggesting as a problem? How many people are affected? How strongly affected are they? Is it, oh, well, this, doing this research will really help people figure out how not to get hangnails. Okay, hangnail, not that big a deal. Probably not the most relevant or important study, right? So overall, if the authors didn't connect their study to either some theory or some real-world problem, then what's the point? Right? The last thing to be looking for, kind of in the intro, is did they identify, a gap in the literature? Has the question that they're asking not been answered satisfactorily in the past? And why not? They should be making this argument. And so they're probably going to be, if not just pointing out no one's asked the question, then they're going to be offering criticisms of other research that has tried to answer the question, but they're not satisfied with how they asked it. Right? So are their criticisms warranted? Right? So if somebody says, oh, well, this effect has been found before, but no one's ever looked to see if this treatment for PTSD is effective for left-handed stamp collectors. Is there a reason left-handed stamp collectors might respond differently? If not, then so what? You don't need to ask that question. It's not relevant, not important. Moving on to construct validity. We've talked about this before already in previous lectures, kind of going over some of the same things again. In terms of the variables they're measuring, and this is stuff that's going to be in the method section, a lot of it in the materials or measures subsection. Um, they should be citing data regarding the psychometric properties of the instruments they used, right? And that has to do with the possibly retest reliability. Quite typically, the internal consistency, right? They'll cite an alpha of some type, and you want those numbers to be pretty high, above 0.7, definitely, preferably above 0.9. And then also they should be citing some other research that has used these measures and shown that they relate to important things and predict important behaviors. Right? Another thing to be looking at would be the variability of the data that they collected. So this would be in the results section, right? So the measure they use or measures they use might be perfectly fine, but not for their sample. Did they have sufficient variability in the scores on their measures to be able to talk about differences on those measures? If everybody scored pretty close to each other, well, then you didn't get enough variability to really do anything with. So you look at the indices of variability, like standard deviation, the most common one, that they report in their results section, and you compare these to the variability in other studies using those same measures, right, which they'll have cited other studies using those measures already. Easy to look those up. You can also look at the kind of the mean levels for the constructs that they're measuring and compare them to other studies, right? So if you're looking at something where they're measuring PTSD symptoms in soldiers, you can look and say, okay, well, what's the average level of PTSD symptoms using on this scale that soldiers in this study reported? Okay, does that seem to be in the same kind of ballpark as the averages reported in other studies also using that measure? If not, you got to wonder what's going on. Is there some reason about the way they recruited participants that you would expect them to have vastly different numbers? If not, maybe that measure isn't performing the way it should or didn't perform the way it should when they used it. Okay. The other thing to keep an eye on is the degree to which they exerted experimental control when measuring variables, right? So were they systematic, and did they standardize measurement? So was everybody measured the exact same way, or were they fairly careless in their measurement of data? If so, then they may not have really measured what they intended to measure. Of course, we also talk about construct validity in terms of manipulating variables, right? The independent variable in an experiment. And again, we're worried about experimental control. How much control did the experimenters have over the manipulation of the independent variable? Right? Was the administration of the independent variable standardized? For example, if you're trying to manipulate mood by showing different types of movies, right? You show one group one type of movie, another group another type of movie. Did they, screen to see who had seen these movies before, right? And then make sure that maybe equal numbers in both groups. Did all the participants watch the movies in the same type of setting at the same time? Right? So how careful were they when manipulating the independent variable to ensure that they were manipulating that and not something else? Right? And even when you're very careful, it can be hard to maintain the purity of a manipulation. And by that, I'm talking about how typically when you manipulate an independent variable, we're wanting to affect one construct, right? Maybe we're wanting to try to make people more depressed, or we're wanting to make them less depressed, or we're wanting to make them angry, or we're wanting to make them hungry, whatever it is. But it's often hard to manipulate just one thing, right? So when we try to manipulate an independent variable, it often has an impact on other constructs other than the one or ones that we intend. So you got to look at their study and say, well, was that the case when they did it? Well, what's the probability that happened? Example, say you're interested in the effects of stress on the immune system, right? So we're going to induce stress by showing some soldiers video vignettes of real-life war traumas, and then showing other soldiers video vignettes of hospital traumas, right? And thinking, okay, well, one's going to be stressful to them and the other's not. Well, we may be manipulating stress, but for those soldiers who are watching the war traumas, we may also be activating memories of their own experiences and may be related to feelings of pride and kind of camaraderie with their fellow soldiers. So sometimes when we're trying to manipulate one thing, we may manipulate other things as well. And so when you look at somebody's study and they said they were manipulating this, is it possible that in trying to do that, they also manipulated some other things, and that those other things that they unintentionally manipulated might explain the differences in the dependent variable? If so, we got some problems. Okay. Uh, internal validity. The basic requirements to establish internal validity, and again, internal validity has to do with, would someone be justified in drawing a cause and effect conclusion based on the results? Well, first off, you have to have some sort of statistical significance. And typically here we're talking about a statistically significant difference between two or more groups on the dependent variable, right? Where these groups received or were exposed to different levels of the independent variable, right? So we did different things to people, that's the independent variable, and we saw that they then differed on the dependent variable depending on what we did to them, depending on what level of the independent variable they got, right? So a statistically significant difference between groups. So you have to have that, which means that, because if you get two groups and you do something to one group and nothing to the other, even if what you did had no effect, there might be some small difference between the two groups, right? Just because two groups aren't going to score exactly the same as each other. There's some random variability there. So there has to be enough of a difference to be statistically significant. And that has to do with how much variability is in each group already, right? That within group variability. Okay, so that's that one piece. But a statistically significant correlation also meets this requirement for internal validity. But we'll see in a minute that correlations typically don't meet all the requirements for internal validity. And studies that aren't experimental, that use kind of correlational approaches, will typically have less internal validity than most experiments. I'd say there's a lower ceiling for how much internal validity a study can have if it's not experimental. So there may be some internal validity to a correlational study, but it's never going to be as much as a good experimental study. We'll see why we look at the other requirements. The cause has to precede the effect, right? So the independent variable has to happen before the effect is observed, right? If you're looking at two groups, that means that I'm going to want to see that a statistically significant difference, but for the cause to precede the effect, so it must precede the difference, that means that the groups must not be different from each other until I do something to them, until I expose them to the independent variable, right? And so this idea of having two groups that are equal or equivalent, to do that I have to avoid something called selection bias, right? And selection bias can occur in a couple ways. One, if you allow self-selection, so you're doing a study and you say, hey, I'm doing a study, do you want to be in this group that gets the drug or this group that doesn't get the drug? Okay, you're creating differences in the groups already, right, based on allowing them to choose which thing they're going to be in, right? I'm doing a study on smoking cessation. Do you want to be in the group that I try to help quit, or the group that I don't try to help quit? Right? People who want to quit are going to opt for the treatment group. People that don't want to quit are going to opt for the control group, right? You can't allow self-selection. It creates a selection bias, right? The other thing would be to use just existing groups, right, which is often convenient. I'm going to do something to these firefighters, and I'll get this one group who's on 44th Street, and I got this other group that's up on 10th Street, and the group on 44th Street, I'm going to change their schedule. On 10th Street, I'm not going to change their schedule, and then I'll see if they're different. Well, you don't know that they were the same before you did something to them, right? There might be something different about firefighters on the 44th Street station than the ones at 10th Street station. So typically for an experiment, you deal with that by using random assignment, right? And you use random assignment in the hopes of establishing equivalent groups. Notice I said hope, because you won't necessarily establish equivalent groups using random assignment, right? Because it's random. So you're randomly assigning people to this group and that group, but you may end up assigning groups that aren't equivalent. Luck of the draw. And so you're more likely to have equivalent groups when you have a larger N, right? If you have more people and you're randomly assigning, it's more likely that whatever differences there are among individuals, they're going to be distributed between the two groups evenly. If you have only, four people in your sample, and you randomly assign 2 to one group and 2 to the other, okay, you may get 2 people that are very similar to each other but very different than the other 2 in one group, and the other group again has 2 people that are very similar to each other but very different than the other 2. Now you have 2 very different groups, and you violated that kind of equivalent groups requirement, right? Where they're different on the DV before you did anything to them. So random assignment hopes to deal with that, but it's not a guarantee. Okay, this is something that you often can't demonstrate with correlational studies, right? Especially if you're measuring 2 variables at the same time, right? Because if you measure them at the same time, one didn't come before the other. An exception would be if you're measuring 2 things that asking people to retrospectively recall, and one thing happened before the other, right? So if you ask people, hey, what was your SAT score? What was your GRE score? Both those things happened in the past. The SAT score happened before the GRE score. So if you're saying, oh, SAT score causes something on the GRE score, okay, you've established a temporal relationship there. However, as you're probably already thinking, that doesn't make really sense for cause and effect. Because there's a third requirement for internal validity that typically isn't met by most correlational studies. And that has to do with eliminating alternative explanations for that difference between groups, or if it's not cause and effect, if this didn't cause this, this might be the reason there's a relationship, or this might cause the difference. Right? So some alternative explanations can be addressed via study design, right? We prevent those explanations from being possible, from being able to play a role. And other of these alternative explanations can be accounted for and kind of disproven via measurement. I'll give you some examples. So let's say we design this study to look at see if we can affect memory with some drug. Randomly assign people to 2 groups, give one group the drug, the other group not the drug. Right? We test the memory, and we find a difference. And somebody say, well, yeah, you found a difference, but you tested the group that got the pill in the afternoon and the group that didn't get the pill in the morning, and so they differed based on time of day, and therefore the difference in performance and memory could be because of time of day. So you can prevent that explanation via good design. So before I do the study, I go, geez, people might say time of day matters. I'm gonna have everybody do it the same exact time of day, right? So I'm eliminating this alternative explanation via my study design by making sure that the 2 groups that I'm looking at differ in no way that I can control other than the independent variable, right? So they have as similar an experience as possible, except for the thing I want to be different, which is the independent variable. So that's how you deal with alternative explanations via design. Think about that same example from a measurement route. So let's say that for whatever reason you're not able to do that. One group, you have one day to do the study, and you only have enough room in the lab to get one group at a time. So one group's got to come in the afternoon, one group's got to come in the morning. And so people are going to say, oh, well, these groups are going to differ because of time, because people are not as alert in the morning. And so if you anticipate that reason, right, maybe I can't get rid of that difference, but the rationale, oh, well, it's because there's a difference in alertness. Well, then I can say, okay, when I do the study, I'm going to measure how alert each group is, right? And if I can show, yeah, I measured alertness, and there was no difference. They were equally alert in the afternoon as the group that was measured in the morning, right? So I couldn't change my design in terms of making them do the same thing. Instead, I just measured that thing that might be different, and I hoped, fingers crossed, that it's not different. Okay? And this, like I said before, this requirement is the one where most correlational studies suffer in terms of internal validity. Right? There are typically too many alternative explanations to be accounted for with this type of design, right? Because you can't, you don't have the experimental control. You have an experiment because you're typically just measuring stuff. You're not doing stuff to people. So, for going back to our example for SAT GRE, yeah, they're correlated, and one happened before the other, but an alternative explanation for, well, you could say SAT scores cause GRE scores, but it's more likely a simpler explanation would be that there's a third variable that is related to both of those. For example, intelligence, that both of these variables reflect, right? And you can't explain away that alternative explanation once you've done a correlational study. Okay, so in terms of threats to internal validity, we'll talk about a couple, and we'll talk about them in different situations. If you're doing an experiment that's post-test only, right? And again, with correlational designs, let me just kind of reiterate, it's hard to establish good internal validity because you can't really eliminate enough of the alternative explanations. You can eliminate some by measuring a bunch of stuff, but typically not enough to really make a strong case for internal validity. So when we're talking about really wanting to make a case for internal validity, we're talking mostly about experimental designs. So different types. One would be post-test only. So I've got two groups, and I'm going to do something to one group and something different to the other group, and I'm going to measure them both after I've done this thing at post-test and see if they're different. So what can threaten my internal validity here? Well, selection bias, which we've already talked about. So things like self-selection or existing groups. So to deal with that, we use random assignment, which again works better when n is larger than when n is smaller. But still, you're going to keep your fingers crossed that, well, I hope they were equivalent. They should have been equivalent. And then the other thing you have to worry about for post-test only design would be any kind of confounds in regards to treatment of participants. And confounds, or a confound variable, is some variable that differs across levels of the independent variable and has an impact on the dependent variable. So a confound variable differs across levels of the independent variable. So I have these two groups. They differ based on level of the independent variable. That's good. If they differ in some other way, okay, now there's a confound variable present because they differ on this confound. And that it's really only a problem if that confound variable has an impact on the dependent variable. Because when that happens, you find a difference in the DV. Now you can't be sure if it was because of the independent variable or because of this other confound variable. In a post-test only design, this is probably your second biggest threat after selection bias, because you got to think, did the participants in the treatment group experience anything different than the participants in the control group other than the independent variable? If they did, that's bad. Internal validity is shot. And this is why researchers describe their methods in so much detail, so people can see, oh yeah, you did exactly the same thing to this group and this group, except for this one thing. And if you notice somebody didn't, if you notice, oh hey, you know what, this group, they got a longer amount of time, or they did a different day, or they were this group was all with the male researcher and this group was all with the female researcher. Hey, that's a difference. That's a confound. Well, that's a big threat to internal validity and a real problem in a study. Okay, continuing with internal validity, you can deal with a lot of the stuff, or with some of the stuff for post-test only designs, right? Because I said before, well, you use random assignment and you just hope they're equivalent. Well, if you don't want to do that, you don't just want to hope, you can go a step further and use pre-test post-test with a single group, right? Because now you have some people and you measure your dependent variable and you do something to that group of people and you measure them again. Now it's the same group of people time 1, time 2. So there can't be a group difference because it's the same people. You're comparing someone to herself or himself, in that whole group. So this also eliminates the possibility of treating the two groups differently, because in reality, really, it is one group, right? But doing this, so we deal with some of those problems, but now we're introducing some other potential concerns. So pretest, post-test, so we're looking at kind of a time 1, time 2 deal, and you can do time 3 even, but simplest, time 1, time 2. There's the possibility of maturation, right? Because with a pretest, post-test, we're looking at as evidence of the effect of our independent variable will be if there's some difference in the dependent variable from time 1 to time 2, some change. Right? So maturation says, well, that difference in time 1 to time 2 might not be due to the independent variable. It might just be due to the effects of maturation, right? Getting older. We change over time. We're not static creatures. Right? This is something that's obviously more of a concern the longer the time gap from time 1 to time 2. If you're doing a study and it's time 1 and then 30 minutes later time 2, maturation not a concern. Even a week, not a concern. This is really only begin to become a concern for adults if you're looking at 6 months to a year. Although with kids, again, their rate of maturation is much faster. They haven't experiencing more changes. So if looking at infants, even a couple of days, there are going to be some maturation effects you have to think about, potentially. So to deal with that, obviously, one way to deal with maturation, other than changing your study design to the next one we'll talk about in a little bit, is to use a shorter time between time 1 and time 2. Instrumentation. This is whenever the differences across time potentially occur because you measured the dependent variable differently at time 1 than time 2, maybe with a different instrument at time 2 than you did at time 1. Sometimes this happens when there are big gaps in time and maybe a better instrument came out when you got ready to do your time 2 data collection. It might also happen due to kind of logistical concerns, so you're doing a study and you interview a lot of people, you do these full in-depth interviews, collecting your DV via face-to-face interviews, and you get their contact information, but when you try to follow up 6 months or a year later, people aren't really wanting to come in, so the best you can do is an online survey or a telephone survey. Okay, now you're measuring that dependent variable a different way at time 2 than you measured at time 1. So even if you did something to them in that interim, the difference you see might not be due to what you did, might be due to the change in the way that the dependent variable was being measured. A third one, regression effects. Again, here's where that difference across time maybe is due to the fact that extreme scores tend to regress toward the mean, toward the average. This is especially a problem if you try to recruit people that would be extreme in one direction on your dependent variable, right? So you're doing a study looking at treatment of anxiety. So you recruit people that are really anxious, right? And say you only let people in your study if they score, so high on an anxiety measure. Thing is, people that score really high on an anxiety measure when they, any given day, get them on another day, and they're likely going to score lower, right? If you're selecting them for being high, because think about yourself. Most days, if you're kind of average anxiety, every once in a while you have a high anxiety day. So if you only get to be in the study on your high anxiety day, now they get you a couple days later, you've done some treatment or whatever, but still your anxiety came down just because it regressed toward the mean. Okay. So to deal with regression effects, you want to make sure that you don't have people that are all just on one end of the extreme that you're recruiting. Mortality effects. This is the recognition that you might lose participants between time 1 and time 2. And it's hard to give kind of a hard and fast number. Well, if you lose this many participants, then you're screwed. It depends. Depends on what you're looking at, how many variables you're looking at. But something you want to think about, because your conclusions might be biased if you lose a lot of people, because those who stayed in may differ from those who dropped out in important ways. Right? So if you're looking again at a treatment study, maybe only those who felt it was effective stayed in. People who it wasn't really working for, they didn't give your time to data because it wasn't working. So if that's the case, then if everybody had given you time to data, statistically you might not have seen a statistically significant difference. But because of the dropouts, oh, now you see when, oh, yeah, my treatment worked. Well, it worked for some people, but it didn't work for the dropouts, which means it may not have worked overall. Um, Hard to deal with this, other than you try to get as much data at time one as possible, and you can look to see then when people do drop out if completers differed from dropouts in meaningful ways. And also, again, obviously, you try to limit the amount of time between time one and time two. History effects. You hope that the only significant thing that happens between time one and time two is what you do to them, right? Your manipulation of the independent variable. But other things may happen. Life happens. History happens, right? So if something happens in this interim period to the participants that impacts their scores on the dependent variable, well, it's a history effect, right? So maybe you have this study where you want to see if showing a film about corporate corruption impacts attitudes towards tax breaks for corporations, right? So you measure people's attitudes towards about corporate corruption. You say, okay, come back next week. I'm going to show you a film, and you're going to do another measure. But during that week that they're gone, the Enron scandal breaks. It's all over the news about corporate corruption. And now they come back in, they watch your show, they take the test, and you see, wow, they're really strongly negative attitudes about corporations. Well, is it because of your movie or because of the thing that happened out there in the world? Not much you can do to fix this if it happens. So you just kind of hope that big things don't happen that will impact your dependent variable. Testing effects, another thing to think about. This is the idea that anytime you repeatedly measure a variable, the dependent variable, the act of measuring something more than once might lead to changes or differences on the measure, even without any intervention. And different types of testing effects. There are practice effects, where let's say it's some sort of test of maybe cognitive ability, right? Ability to how quickly can you press this button when a certain symbol crosses the screen, and you're doing something that you think will increase their ability to do that. Well, just the more you get to practice doing that, so time one to time two, you should get better. So there are practice effects there. Fatigue effects. So if you're having somebody do something over multiple time periods, they may get bored or just tired of doing it and start to perform worse just because they're being measured repeatedly. And then last, there are these kind of catching on effects, right, where being repeatedly tested creates a demand characteristic, and they catch on. So you ask me about how I feel about my body. You showed me these pictures, and you asked me again how I feel about my body. Okay, you must want me to say something different. If you're asking me the same questions again, I shouldn't have the same answer. This study is about, will I feel worse about my body? Okay, yeah, I want to help you out, and then I'm going to change how I answer, because I think I figured out your hypothesis. Okay, so to deal with some of these things, you can use a slightly more complex design, right? Move on to the pre-test, post-test with two groups. So you have two groups. Ideally, you randomly assign people to be in one of two groups, the experimental group or the control group, and you measure everybody at time one. And then you do something to one group and something different to the other, or nothing to the other, whatever it is, and then measure them both again at post. So this solves many of the problems we just talked about. To some degrees, in terms of, both groups, your experimental group and your control group, may still be affected by these things that we talked about, like regression to the mean, but they should be affected by them equally, right? Assuming we don't have selection bias. If we have equivalent groups, we should have same amount of regression to the mean in both groups, same amount of practice effects in both groups, all those things the same for both groups. So, if that's true, then if the experimental group shows a bigger change than the control group, then we conclude that bigger change is because of what we did differently to that group, because of the independent variable. So now the only problem is that we have is if the previously mentioned threats don't affect the groups equally. And primarily, there's two things right here. One being a selection by maturation interaction, right? So maybe I made a little mistake here, and I didn't use random assignment for my two groups, right? And I was like, well, I'm going to be measuring both pretest anyway, and maybe I've got existing groups. But I say, you know what? I think I've got the 44th Street firefighters and the 10th Street firefighters. I'm pretty sure they're the same. So I go and I measure the variable I'm interested in both groups. And I do a statistical analysis. I show, oh yeah, there's no difference. They're the same. They're the same on my variables. Oh, excuse me. Okay, great. So they look like they're the same because they're the same thing I measured. But problem is, they may have been different in other ways, and these differences may then cause them to change at different rates or in different directions on the dependent variable over time. I'll give you another example. Let's say we get two existing fourth grade classes, right? And I measure them both and show that they're equivalent on math achievement at time one. And then I'm going to give one classroom iPads and the other one not iPads to see if providing a fourth grade class with technology will increase math achievement, right? So hey, these groups are equal. Now I give one group iPads. Wait a little while, measure it again. Now the group that got iPads, better math achievement. Yeah, iPads are wonderful, right? Maybe. What if? Yeah, they were the same at math achievement at the beginning of the year. But what you didn't know is the class that didn't get the iPads, their teacher was just kind of crappy, or maybe the teacher had to leave on maternity leave, and then the substitute teacher came in, right? So now their math skills didn't improve across time as much as they would if they'd had the same quality of teacher as the other class. So now they were the same initially, but they changed over time because they weren't the same in every possible way. That's that selection by maturation interaction. The other one, going back to mortality, and really it's a problem here if you get differential attrition, where more people drop out of one group than the other. And often what will happen is more people will drop out of your if your treatment is kind of onerous, right? Like it takes a lot of investment. You got to keep coming to these therapy sessions, and you got to take the two buses and the subway to get there. People may drop out. Whereas there's this control group that doesn't have to go to any sessions. They're just on a wait list. And then, so a lot of people drop out of the treatment group. Nobody drops out of control. I look at the end. Hey, the people that are in the treatment group are doing way better than people in the control group. Well, those are the people that were dedicated and stayed in the study, and it was working for them. It was a small number. So again, all the people that dropped out, maybe it didn't work for them. So again, it's something that is most likely to cause biased results if you have different rates of completers in the two groups. Okay, moving on to external validity. And again, external validity is something where it's really kind of in the eye of the beholder, right? When we talk about, oh, this study had really poor external validity, and the authors may argue, well, we weren't trying to generalize it as far as you're trying to generalize it. We only want to generalize it this far. So how far should something generalize? Depends on for what purpose. Who's trying to generalize? So external validity is a very kind of relative thing in terms of how far you're trying to spread some truth beyond a study. Okay? Because there's no requirement for a study to be, and it's probably an impossibility for any study to be true for everybody at all times in all situations, right? So all studies have a finite amount of external validity. How much should you have? Depends on what you want. But what kind of things will impact external validity? Who the participants were, right? So we're talking about obviously demographics, right? Are these people in the Western world? Are they in North America? Are they in America? Are they English speakers? Is it adults, children? What's the ethnic diversity? What's the kind of socioeconomic status? Looking at gender, sex, sexual orientation, all these kind of important characteristics of the participants. If everybody in the group, in this group, was the same as each other in all these categories, but not like the rest of the world, okay, it may not have that much external validity. Right? The other thing to think about beyond the demographics is how were they recruited, right? Might this sample that was used in the study be unique in some way based on how they were recruited? So let's say, they've got this really ethnically diverse group, and they were all solicited via Facebook. Okay, well, now you've got people who are probably somewhat computer literate. That's probably going to be related to SES to some degree. It may not. What you find about those people may not extend or generalize to people that aren't like that, that wouldn't be on Facebook. Right? Again, how were the variables measured? And this goes back a lot to pulling stuff from construct validity. But beyond that, thinking about things like, if we find differences, we're looking at depression. We find differences in scores on the Beck Depression Inventory for some new treatment. Okay, so with this treatment, they scored lower on the BDI. Okay, does that mean that if I use this treatment, my clients will be less likely to commit suicide? Maybe. I mean, suicidality and BDI scores are related, but they're not the same thing. So how far does that truth generalize? Like, if I do exactly what they did in that study, and my clients are like their participants, they should have lower BDI scores. Is that what I want? Right? If I have a clients coming in and they're depressed and they want to find meaning in life, are they going to find meaning in life? I don't know, but they'll have lower BDI scores. Right? So, what was measured? What is it that you're going to try to apply this truth to beyond how they measured the construct? Same thing with how the variables were manipulated. How likely is it that the independent variable, as was manipulated in the study, would be recreated the same way in the real world? Right? So, classic studies using pictures of defendants accused of crimes, right, they manipulate how attractive or ugly they are. And participants, sentence them to, 5, 10, 20, 30 years, right? Is seeing pictures of these defendants really the same thing as seeing them in 3D in a courtroom? I don't know. And then with treatment studies, would you conduct that treatment the same way it was done in the study? Because typically a treatment study that is done well with a high degree of experimental control is a manualized treatment where everybody doing that treatment did it the exact same way with a certain sequence and made sure to do things following a manual, following rules. How likely are you or other clinicians going to be to follow those same rules? If not very likely, or if it's not possible given most settings, then there may be poor external validity. Okay. Next thing to think about would be the statistical analyses. So, power. Did the study have sufficient power to detect an effect, or if it's looking at a correlation study, sufficient power to detect a relationship between variables? And this is something that is a statistical analysis type of deal, and they can do a power analysis before they do their study to see how much power will we have, and they can also do it kind of post hoc, how much power did we have. Things that affect power, things to look for, sample size. Larger samples typically provide more power, right? So if you see in a study and say, oh, we did this study to see if this treatment was better than this one, and we found no effect. Okay, well, maybe it didn't work, or maybe it worked, but you didn't have sufficient power to detect the fact that it did work. Maybe your sample size was too small. Or maybe you didn't have enough of the right types of variability, right? If you have very diverse groups, which is good for external validity, right? Like a diverse sample. But if you're really a diverse sample, you're going to have lots of variability. When you have lots of variability, people with all over the place, all kinds of different problems coming into your study, it's harder to find a difference between two groups of diverse people. If you get two groups of very homogenous people, I get a whole bunch of people all recruited from the same town, the same high school, and I randomly assign them into groups. I do something to one different than the other. Now it's going to be easier for me to find a difference between those two groups than if I'm sampling from all over the world. Right? So more homogeneous samples lead to better power. Again, downside is poor external validity. And then the other thing to think about, what was the effect size that should be expected? And this is something that's based on previous studies. Right? So when other people are looking at these, the treatment of PTSD, what effect size did they report? What's the average effect size? And there are plenty of researchers that make their livings just publishing papers summarizing the effect size of other people's studies. So not hard to find those looking for things like meta-analyses. That's what those are typically doing, summarizing effect sizes. Last thing here, again, especially if they didn't find a difference, didn't find an effect, maybe they didn't have power because all these things related to their data. Maybe it had to do with how they manipulated the independent variable. Maybe they didn't have a strong enough manipulation. So again, if you're looking at a treatment study, so well, we gave them 4 sessions and they didn't get better. Well, maybe you didn't give them enough sessions. Maybe you didn't have enough of the treatment. If you're looking at the difference between hearing, this noise versus that noise, maybe it wasn't loud enough. Maybe the noises weren't different enough. How strongly did they manipulate the independent variable? Enough to create some power, or not? The other thing, the assumptions of the test. The validity of the use of a particular test is dependent on the degree to which the assumptions of that test are met. Right? And we can't really go through here all the assumptions of all the tests, but good researchers will at least address that in the results section, that there weren't significant violations, or if there were, how they dealt with them, which there are things you can do. But whenever you see that, whenever you say, oh, well, the normality assumption was violated, or the heterogeneity of variance assumption was violated, and therefore we transform the data, a little red flag. Not a huge red flag, but anytime you're having to deal with these violations and transform your data, which is basically saying monkeying around with your data, you're getting a little away from the truth of the numbers, and you're getting kind of this analog of the truth, which is mathematically seems to be good enough, but it's not quite as good as if you'd originally met those assumptions. The other thing to think about in terms of stats and assumptions is family-wise error rate. As a general rule, the more tests that are run, the more likely it is that a researcher will make at least one type 1 error. Again, type 1 error is when you say, yeah, there is a difference, yeah, there is an effect, yeah, there is a relationship, but in reality, there's not. Right? In reality, the null hypothesis is true. Right? And you can calculate the probability of making at least one type 1 error, and the rate of that, and that rate is the family-wise error rate. So if you're reading an article and somebody ran a whole lot of tests and they make no mention of changing or altering their alpha to correct for inflation of type 1 error rate, there might be a problem, because then if they have some significant correlations or significant differences, well, those might just be due to chance, right? If they didn't take the appropriate steps to deal with that. Okay. Last thing I want to talk about, ethics. More and more, you're seeing manuscripts getting published where the authors indicate that they got IRB approval, your internal review board, and what IRB it was, the University of South Carolina IRB, United States Army IRB, whatever it is, which is kind of reassuring to their peers that, yeah, we went through the appropriate steps, and we had somebody else look at this that wasn't invested in us doing well, and saying, yeah, it's okay to go out and work with these human subjects and do the things you want to do, measure the things you want to measure, and we don't believe you're going to really cause too much damage. They'll probably also be mentioning that they got informed consent. That'll be in the method section. They'll address the potential benefits and harms of the study. Sometimes you won't see this talked about as much, but certainly something that you can look out for and kind of be thinking about. Okay, imagine if I were a participant in this study, what would I get out of it, and how bad would it have been to be in that study? Right? But I think the thing that and people do a pretty good job now of, especially with IRBs, of not letting people do research where the harm outweighs the benefit, or even where there is any kind of significant harm. The place I think as a consumer you need to pay attention is in terms of the distribution of burden. Right? A lot of research involves some level of sacrifice, right? Either pain studies where you're experiencing pain, or drug trials where there's these, okay, here's this pill, we know what it does to rats and rabbits, we don't know what happens to people yet. Why don't you try it? So these risky drug trials. Excuse me. There's a bit of a burden on being in those trials, right? And that burden, the research should not be conducted disproportionately with low income, disadvantaged, or disenfranchised populations. When that happens, and it often does happen, especially, thankfully not so much in our field, but in other fields, that's unethical and unfair, right? And so that's something to kind of be looking out for. That's one thing that IRBs do try to be aware of, is when people are working with, in any way, kind of vulnerable population, are they taking steps to make sure that they're not taking advantage and kind of putting them too much in harm's way, and not sharing the burden equally among other groups. And the last thing would be that, again, an ethically conducted and written article will have appropriate citation throughout. This is something that can be hard to catch sometimes, and largely we run on a bit of an honor system. But every once in a while, somebody will be reading an article and say, "Hey, that sounds a lot like something I wrote 10 years ago," and then look it up, and hey, sure enough, that's plagiarism. When that happens, the consequences often are pretty bad for any kind of academic that doesn't cite appropriately. So it does self-correct eventually, just not necessarily immediately. Okay, I think that's all for now.